Welcome back, and we're moving into our first conversation for today as we find out more about Vaccination Week of the Americas. We're joined at this time by Dr. Natalia Larga-Espada-Bear, who is the Maternal and Child Health Technical Advisor for the Ministry of Health. We're also joined by Nurse Sharon Espinoza, Nurse Administrator for the Expanded Program on Immunization. Good morning and welcome.
Good morning. Thank you very much.
Now, I want to start off with just an update. Last week, the Ministry of Health issued an advisory to the public regarding whooping cough and a potential case that may have been detected in Belize. Was there any confirmation to that case?
Well, thank you very much for having us today to share with the public on this situation. And yes, we received a communication from the CDC that there was a positive case of a 15-year-old male that happened to travel to Belize for a vacation. So the results were released while this person was already traveling to Belize.
Okay.
So we followed standard procedure. We received the information Friday afternoon. So we had the team working Saturday, Sunday, right through, contacting, following the trail of this person that was on vacation, the family, and making sure that the population that was having contact with the person that was infected received information about the signs and symptoms, the incubation period, the transmission period, and where and who to call if anyone were to present the signs and symptoms. And more importantly is to ensure that persons are aware that children need to be vaccinated now and have their vaccines up to date to protect them against whooping cough.
Now, it's interesting to see the ministry jump into action for one case. Why was it such a concern?
Well, the issue of having these type of diseases, once you diagnose it by protocol, we're supposed to ensure that we reach out to the population, sharing with them how to protect themselves because of the high transmission rate. It's transmitted through droplets from the nose. So anyone coming in contact that haven't received the vaccine is at great risk.
Now, looking at the celebration, shifting now to the celebration of vaccination in the Americas Week, tell us about, this is an event, or I should say an period of observation coordinated by the WHO and PAHO. Why is it something that requires focus at this point in time?
Vaccination Week in the Americas is 16 years old. This is the 16th year that is being celebrated. The region of the Americas is one of the pioneers in establishing interventions to improve the health status of the population. So this Vaccination Week in the Americas actually now is Vaccination Week in the world.
Oh. Yeah.
But it born here in the region of the Americas. So the Pan American Health Organization is one of the most important organizations that put forward this strategy. Started in one of the southern South American countries. They had low coverage and they did a massive campaign to increase coverage in communities with low vaccination coverage. And from there it born that probably it would be a good intervention to have these 1 week observation for improving the access, improving information about vaccines to underserved population. So that's how it born, and we have been implementing it since probably 13,
Okay.
Can you
13, 14 years.
Can I just add also that we are celebrating this year under the slogan, strengthen your defense. Hashtag get vax, hashtag vaccines work. And this slogan came up because of the FIFA World Cup that is going to be held this year in Russia, we'll be having a lot of persons traveling
Yeah.
round and about, so it was ideal to select this slogan for this year.
Now, can you guys reiterate to the viewers out there why it is so important to have children vaccinated?
All right, I must say that vaccination for the Ministry of Health has proven over the years to be a worthy investment. We have seen where our last case, for example, of measles was in 1991. So the record is there to prove that vaccines work. And children are our most vulnerable group, most susceptible groups to getting these illnesses. So the focus is on them to ensure that they get vaccinated.
Now, the vaccination coverage that we have in Belize has been a jewel in the crown of sorts for the Ministry of Health. We have been able to get very good results, I know, over the past years. Are we still, it was something like 90? Was it about
Definitely
90?
over 90%
Over 90% coverage. Are we still at that point, or
Yes.
are we starting to see where people are beginning to question whether or not they need to get vaccinations?
In terms of the statistics, yes, we are still at that point in general. But I can also add that, yes, we are having persons asking questions now. It's not as easy as it used to be before to give a vaccine.
Yeah.
But that is okay, and the information is available to prove that vaccines work.
Yeah. And we are providing the vaccines at the health facilities and during mobile clinics.
Yeah. Now let's step back a bit to some of the basics. How do the vaccines work? I really find that people don't necessarily understand what a vaccination is, and it comes about most often when we talk about the flu vaccine. But let's move
Yeah.
into that.
A vaccine is, for example, if we were to have, let's say, that cup, that's the virus, then that cup would be like grind up, turn into powder, just to give an example. And a little bit of that powder is then constituted as a vaccine. And that small portion of the virus is not capable of causing, in some of the vaccines, the disease itself. But because it contains part of the virus, some of the vaccines is the outer part of the virus or bacteria that is used for the vaccine. So when the real virus or bacteria come in contact with the body of this person, their immune system already have developed antibodies to fight off the infection.
So when you do get exposed, your body knows how
Yes.
to fight it off
Yeah.
because you've been exposed through the vaccine.
Yeah.
Yeah. And our current health or our current vaccination schedule, what does it cover?
Okay, our current vaccination schedule goes like this. We have first the BCG vaccine. It is given at birth, and in February of this year, we've started giving the hepatitis B vaccine also at birth. After that, we give at 2 months, 4 months, and 6 months what is known as the pentavalent vaccine. It is 5 vaccines in one, protecting against diseases of the lung, diseases of the liver, pneumonia, meningitis. That's at 2 months, 4 months, and 6 months. Then at 1 year, the child will return for the measles, mumps, rubella vaccine, MMR. We give 2 doses to ensure that this child or this person seroconverts, that the vaccine works at its optimum. So we give 1 at 12 months and 1 at 18 months. After that, we give at 4 years, we give a booster of diphtheria, tetanus, pertussis. We have now started with HPV vaccines in schools. So standard 4 girls between the ages of 9 to 13 years, 14 years gets the HPV vaccines. Also, we give the school leavers, the primary school leavers, the standard 6 students, the diphtheria tetanus vaccine. We have more on the schedule. We also cover our pregnant women with diphtheria tetanus as well.
Yeah.
I'm
And the flu
interested.
vaccine. Yeah.
And the flu
And
the
yellow
flu
fever
vaccine, we also give the flu vaccine from babies are 6 months. We give that vaccine. It's an annual vaccine given. We also give yellow fever vaccine. Yellow fever is given to those persons who are traveling to countries where yellow fever is still there.
Endemic, yeah.
Countries like in Africa, Colombia, some of the South American countries still do have yellow fever. And I must say one thing about yellow fever to the general public, that it would be best for you to come and get the vaccine at least 2 weeks before you travel, so that the vaccine can be at its optimum level when you reach in that country. So 2 weeks before, and because the vaccine is a multi-dose vaccine, you get like 10 or 8 persons out of using one vial. We ask the general public to please check with your nurse. They all have a schedule, they all have a list that they compile, so as not to waste the vaccines. We ask that they come in groups to maximize the use of the vaccine.
I am interested particularly in coverage in rural areas. I know that you have villages that are far flung, and you have pregnant women, you have newborns who are in need of access to these particular health services. How does that work in terms of either outreach or having them come into the nearest facilities?
We do have mobile clinics for the persons living in the deep rural areas. And I must say that coverage in those areas are pretty good for the most part. Our challenges with coverage is in urban communities. Nurses
Where you have to go to get the vaccine.
That is correct.
Versus the rural communities where they come to you.
Yes, that is correct. In the rural facilities or in the rural setting also, there are times when the nurses would have to walk into these communities to get to these communities because transportation can't go into these areas. So I must say at this time, thanks so much to the many nurses who are putting their all, working under extreme conditions at times to give, if it's just one vaccine.
I must say that the government of Belize fully support the immunization program
Yes.
each year.
And
that
these are all free. That's
Yes.
the
Yes.
key
Yes.
thing
Yes.
for people to know.
Yeah. And these are provided every 6 to 8 weeks, as Nurse Espinoza was explaining, with the mobile clinic. So each community have at least 6 visits per year.
Now, where are we? Who's the population that's not getting the vaccine? Let's talk about that.
Well, it's just a few pockets of susceptibles. For example, pertussis, we follow the protocols. If we have a positive case, we should conduct an investigation and provide information and services to population at greater risk. But every year we have a small cluster of cases of pertussis, and it's usually among population that is not vaccinated.
And these
But-
communities aren't getting vaccinated because they choose not to, or you don't have access as yet?
And some of them are religious-based communities that have their own beliefs, but
Okay.
evidence have shown, as Nurse Espinoza was sharing, for example, with polio, is 99.6% of number of cases that have been reduced in 22 years.
Yeah.
I mean, you can't go wrong with that.
Yeah.
Everybody know the consequences of polio. And we
Yeah.
don't want that for any of our children. And
So they choose not to get vaccinated because of religious reasons. But here's what I find interesting. There's some countries you can't travel to unless you have
Yes.
particular vaccines. You are not going to be allowed into the country unless you have those vaccines.
we have had those cases to where persons are or families are traveling abroad, and then they bring the children at greater age, older ages, to get vaccines to comply with the requisite of these countries to enter. So
Yes.
Not
it's,
because it's being offered in Belize, but because they want to travel somewhere else.
Yes.
but the greatest protection is earlier in age. The earlier the child gets the vaccine, it's better for the child.
When we were growing up as kids, and this was perhaps 20 some odd years ago, you heard mostly about diseases such as polio
Yeah.
and measles and that sort of stuff. But I guess through public education and through an aggressive campaign to ensure that persons are vaccinated or immunized at a young age, you don't really hear about it that much now. It's almost as if though it's either negligible or non-existent.
Yeah.
And that is so
That's
true,
true.
and that is the evidence that we have to encourage the general public that vaccines are safe, vaccines are effective. In 2016, actually, the measles was eliminated from the regions in the Americas. Yes, we currently have a few cases wrong and about the country. We don't have measles in Belize. And these are some of the achievements that we need to highlight, that
And to
vaccines work.
Well, and I was going to get to that. Over the years, with the help of vaccination, there's even been the elimination of diseases. Let's talk about some of the diseases that have been eliminated.
Well, the first example related to vaccine, the polio, poliomyelitis, yes. The last case was in 1981 here in Belize.
Yeah.
But for us to maintain that status, every year, every day, we need to continue the vaccination. Countries that have changed their strategies based on the non-existence of the disease, then you see that they start having cases. In Brazil, the last time they had the World Cup there were cases of polio that started there as a result of that conglomeration of huge amount of population.
And
in
in fact,
these
there's
type
a
of
campaign to
celebrations.
end polio because
Yes.
we're
Yes.
so close as a global community.
Yeah, we went from 125 countries worldwide having polio to 4 countries. So it's 4 countries where the majority of the cases of polio that the world have currently are coming from.
What about tuberculosis, for instance?
The BCG, what it does is protect the person against the grave forms of tuberculosis. But tuberculosis is there and around with us.
So it's like the flu shot. It's that you don't get the really, really bad version of it. That's what you mean?
Yeah, yes.
Okay.
But the bacteria is it can last for years in the environment, so it's a more difficult disease to fight. And you see it now more common. I mean, it was more common before,
Yeah.
but now you see it more in persons that have immune compromise.
Yeah.
Their immune system is low.
Yeah. Now, I suppose the double-edged sword of eliminating or drastically reducing instances of particular diseases is that you then have medical professionals who perhaps don't know to recognize symptoms or to diagnose these diseases.
Yep.
How do you work with the medical community to ensure that they're up to date, that if a case of polio comes in, for example, that they would know the signs to look for, or measles, or whooping cough? How do you work with them that they stay up to date? They probably went to medical school, came back, and never even seen a case.
Yeah, that's true.
Tetanus, too, is a good
Yes.
example.
Yeah. We have a surveillance system in place. So there are signs and symptoms that whenever we find patients with those signs and symptoms, we need to conduct an investigation because we rule it out immediately as potential case of polio or measles. So in the case of polio, we're talking about a person with acute flaccid paralysis. That's all the person needs to have, and then the surveillance system is triggered. A sample is taken and sent to CARFA in Trinidad and Tobago, and then we wait on the result and see what happens. Some, I remember a few years ago we had a young lady with and a child also, and what they came out positive for was adenovirus.
Which is?
Adenovirus it's a virus that causes similar symptoms like polio,
Okay.
but it's temporary.
Okay.
Yeah, so they got over very good.
Yeah. So when the child came in with the
Flaccid
paralysis,
paralysis,
they were tested for polio,
Yes.
but it wasn't that case.
it wasn't that case. So then they would run other tests, that and adenovirus was that came out.
In addition to what Dr. Beer said, as it relates to the medical officers being up to date, we at the Ministry of Health provide training. We do training at the national level, and we also do training at the regional level. And we try as much as possible to get private sector to be involved also, because they are a part of the health system as well.
Yeah. Now we spoke, we have a pretty good immunization schedule in terms of coverage, but we've seen over time where more vaccinations are added. The HPV, the flu vaccine are two. I know that
Hepatitis B for
the hepatitis
birth
B.
dose.
So what are some of the vaccinations that you're working to be able to add to the schedule? Or are we simply going to stay as we are with what we're covering?
We have countries that provide much more vaccines than us. So we are providing the basic.
Yeah.
We are probably about 70% of what other countries are providing. And it's based on the epidemiological profile of the country.
Yeah.
So we have, for example, next that we would like to include, but the price is still high, is the rotavirus vaccine.
I was going to
which
get
is
to that.
important,
Yeah.
and
Yeah.
pneumococcal vaccine.
Yeah. Rotavirus vaccine is to cut down on the number of
Diarrhea.
bad belly, diarrhea, and vomiting that we have, which we
That
do
cause
have a lot of.
severe dehydration.
Yeah.
Yes. Yeah. So that's the next one in step that we have.
Yeah.
When you
But-
mention the epidemiological profile of the country, where does Belize as a country, in the context of that particular scale, so to speak, where do we fall?
Well, our main problem right now, if you look at the statistics, is the non-communicable diseases. And because of the successful vaccination program that we have, the vaccine preventable diseases are non-existent or pretty low. And the next one, diarrhea, for example, last year we had an outbreak that wasn't good at all. And we know it, majority of cases were caused by rotavirus, so we know that we need to start putting together the resources to include that vaccine. But other than that, years before, we never had these type of outbreaks that we have now with diarrhea. So it's something that we need to consider. So if 5 years ago you would have asked if we would introduce rotavirus, we would say we need to wait for the price to come down. But now, with the outbreak that we had last year, we know that we have to try and see if we can make an effort to include the rotavirus vaccine in the package.
So how does the ministry then go about in terms of the procurement for these vaccines? I know cost is one thing, and we're always looking to see if we could get a bang for our buck, or we could get a more when the prices go down. How does that procurement process work?
You have different types of conditions or situations in which countries have their immunization program. Some of them have it fully via donations, and when the donor agency cannot provide more, then they run into problems. We are blessed to have the immunization program to be a part of the recurrent cost within the fiscal budget for the Ministry of Health. So, for example, the HPV vaccine. Before we introduced the HPV vaccine, from the first year it was released, we know we wanted to include it in the vaccination schedule, but the cost was 125 US each dose,
Very expensive. Yeah.
and we couldn't afford it.
Yeah.
But in the meanwhile, what we did was a series of study. We did a needs assessment of the cervical cancer program. We did the cost effectiveness analysis for the introduction of the HPV vaccine. We had a campaign demonstrating the presence or the circulation of HPV, and 16 and 18 came up to be the one with the highest frequency.
Yeah.
So using the evidence that is there, and with the drop of the price, with the HPV vaccine, the current price is $9.8 US. So
Okay.
we would want to vaccinate from 10 years up to 26. Do we have the resources? No. So we start out with one cohort. If the vaccine were to, the price drop much more, then we can lobby with the government and see if we can get in at least one cohort more or two cohorts.
Yeah. All right. Well, we know the HPV vaccine, once it was first announced, came with a bit of controversy as well.
Yes, yes.
And I'm going to get an update from that in just a few. What we'll do is take a very quick break, and when we come back, we'll continue our conversation with representatives of the Ministry of Health talking about vaccinations. Stay tuned.
When someone you love becomes a memory, the memory becomes a treasure. Channel 5 introduces the Daily Obituaries. The Daily Obituaries will broadcast all death and funeral announcements and memorials to honor your loved one's life and memories. The Daily Obituaries airs on Channel 5 prior to the evening newscast, with subsequent repeats at 10 p.m. and 12 noon the following day. It will also be placed online on our social media platforms, all for a standard package fee. Celebrate their lives and memories with Channel 5's Daily Obituaries. Honor in life and reverence in death.
And welcome back. And if you're just joining us, we're continuing our conversation with representatives of the Ministry of Health as we focus on Vaccination Week in the Americas, also being celebrated globally. Dr. Bear, before we went to the break, we were speaking a bit about the HPV vaccine that was introduced to Belize. Was it 1 year or 2 years ago?
2016.
2016. It was, I know, the fruition of an effort or a campaign that had been ongoing for quite some time, justifying the cost of the vaccine for the benefits. Let's go back to why this was a necessary investment in your eyes for the Belizean population.
It is now demonstrated that the evidence is there that HPV infections lead to cervical cancer. So there are 13 different types of HPV viruses, and 2 of them, 16 and 18, are the most aggressive one that can lead to cervical cancer. About 80% of the population is estimated to have HPV infection at least once in life.
And that's male and
The
female.
body, male and female. The body have the capacity to fight it off, but the persistence of that infection is what leads to cervical cancer. So what the vaccine does, the HPV vaccine, is to reduce the risk of infections due to HPV that can lead later on to cervical cancer. So that's the importance of the vaccine. We, as I mentioned earlier, we started late because of the cost. So that was a barrier for us. But if we use as example Australia have data showing the huge, significantly reduction of girls being infected with HPV 16 and 18 before the vaccine and after the vaccine was introduced in Australia, because they were one of the first countries that introduced it into their schedule.
Yeah.
So it's the primary prevention of cervical cancer. No woman should be having cervical cancer, or much less dying from cervical cancer, because of the time frame of that cancer to develop, which is 10 to 15 years, and you have enough time to diagnose and treat, and the vaccine even gave you a better push because then it prevents the HPV infection.
Have you guys been able to sort of mitigate, for want of a better word, the controversy of this whole HPV vaccine being introduced to young girls? I know there were some folks who were kind of wary and who came out strong against it because of the perception. Have you guys as a ministry been able to sort of educate or try to kind of change people's perspective on it?
HPV vaccine, because of being one of the most controversial vaccines, is the one that is being more studied because of the controversy.
Yeah.
So the vaccine is safe as recommended by the World Health Organization. What we do is we ensure that we provide information to parents and to the girls that will be vaccinated, and let them ask all their questions, and then let them make their decision, but an informed decision.
Yes.
So it's not just walking into a school and providing the vaccine. No, we have to make that effort to reach to the parents and talk to them. And I must big up the Ministry of Education, because they are fully supporting public health interventions within schools that we're having currently.
I just want to add that the coverage we have seen, we are now on the second round of HPV vaccination. So the coverage we are seeing is actually going up.
So right now we're only working with Standard 4 girls in
Yes.
in schools.
schools.
What happens? This is obviously going to be able to keep the generations that are to come free of HPV and reduce the. Is it still the number one cancer that kills women in Belize? Cervical cancer.
Second year.
Yeah, the second. So what is the plan in terms of being able to offer, because you still have that standard 5, standard 6, maybe even up to second form age girl that may benefit from this vaccine?
Well, as I mentioned earlier, the problem is the access to resources.
Yeah.
Right now, the cost of the HPV vaccine is about 40% of the budget for the immunization program.
Wow. Yeah.
So increasing to one cohort will definitely carry us out close to a million.
Yeah. Yeah. So, and I think that's one of the things we don't discuss enough. How do you justify the cost in terms of expending this much on a vaccination or not in making the investment?
And now that you're talking about costs, the vaccine was introduced 5 years before by private sector.
Yeah.
But the price
But at the
yes.
130 something per shot. Yeah.
Yes, definitely. So we give them the information,
Yeah.
and we provide them with the evidence,
Yeah.
and they make their decision. When we did a needs assessment in 2005, 2006 for cervical cancer, it costs more than $40,000 just to treat cervical cancer, because we don't have in country the resources for treatment for advanced cases of cervical cancer. So the least one can expect to invest is about $40,000 based on
Per person.
stories that we have collected among survivors or relatives of persons that died with cervical cancer. So, I mean, against a vaccine that is free of cost, that will protect you against that investment, unnecessarily investment, and unnecessarily disease, cancerous disease.
How did you offset the concern that people had? I know one of the concerns that we heard when the introduction of the vaccine to the schools, to the school age girls, was that giving them a vaccine that is related to a sexually transmitted infection is educating them about sex. How did you educate them, but not necessarily cross the line as to that sensitive information?
There are researches in other countries. We haven't done any yet, but it's impossible to talk about the HPV vaccine and not talk about sex.
Mm-hmm.
So we find it with all the different persons that we sit and have a chat about the HPV vaccine. We're talking about religious leaders, community leaders, parents, and even students. But researchers have shown that because the HPV bring in the topic about sex, then the young people increase their knowledge about sexual activity, sexual contact, and rather they have seen a decrease in sexual intercourse that is early.
I'm sure if you introduce the risks
Exactly, yes.
of sexually transmitted infections, I would imagine it probably gives you further insight into consequences of your decisions.
Well, perhaps
So it doesn't carry up the rate.
yeah.
It doesn't reduce it that much, but there is a tendency to reduce, to delay the sexual activity.
Perhaps a part of that controversy stems from the fact that parents feel as though they ought to be the ones to introduce sexual education to their children prior to it being brought to them in a school setting in the context of this vaccination. It's interesting because sex is a fact of life. I mean, you can't escape that. But much more important is the idea of informing young girls of the dangers or the risks of not being vaccinated and perhaps unknowingly exposing yourself to the HPV.
Yeah. That is, if your asseveration would be 100% true, that parents are to be the one providing the information, we would have much less health problems, much less. Because really and truly, they have the greatest responsibility. So the other government institutions that are providing services to this population, adolescents, we also share the responsibility. And the churches share the responsibility of providing this type of information in a timely manner and correct information so that the young people have the knowledge, the basic knowledge about making these type of decisions. So why delay sexual activity? What are the benefits? What are the negative outcomes? And especially if there is no protection. We know that by law, the age of consent is at 16. And the evidence is showing that having a child below 17 years, your first child before 17 years, one of the outcomes could be cervical cancer.
Yeah.
Because of the exposure of the cells to the infection with the HPV virus.
Yeah. Yeah.
It have a greater impact if you receive it at earlier age than later in life.
And as you pointed out, right now I think the best case study is looking at what's happening in Australia and their reduction in cervical cancers, which is one of the preventable forms of cancer, but we still see quite a number of deaths from in this country.
Yeah.
Nurse Espinoza, you said that the coverage right now is fairly good.
Yeah.
What percentage would you say it's at this point?
We are over 70%
Okay.
for HPV.
Okay. And is there a program in place to kind of catch up with those who didn't take it the first round?
Certainly, when the nurses return to school in May, to the schools to give the HPV vaccine, we usually get persons whose parents decide, all right, I think my child will take the vaccine.
Okay.
And we also encourage parents to visit the clinic if they did not get it at the school to get the vaccine.
So the key issue here is to be able to get the girls vaccinated before they initiate any type of sexual activity. That's why we're working with this particular
Yes.
age group.
Yeah. And the next reason is because we have a high enrollment rate in primary schools. And standard 4 is the one that have the largest number of girls.
Okay.
So by standard 6, if we were to administer the vaccine in girls in standard 6, we would lose 20% of those girls in
Oh, wow.
standard 4
Wow.
because of the dropout rate.
Wow. I didn't. That's a whole other conversation we need to be having. Now, I don't want to miss the opportunity to talk about the anti-vaxxers campaign, and to be very careful because we don't want to encourage people. But we know there are some people who listen to what's happening in other parts of the world. In the United States, for example, there was an anti-vaxxers movement, which we find that since the study, the information about the fake study has been continuously debunked, more people have been becoming aware. Do you find people in Belize who kind of follow that same campaign saying, oh, vaccinations cause autism or vaccinations are bad for your children? Do you hear that kind of information coming out?
Yes, we do, but it's not a lot. So we are grateful to that fact that we don't have a lot of anti-vaxxers in our country.
Yeah.
As Dr. Beer mentioned earlier, it is mostly in those religious based communities that we would get the challenges.
Yeah.
Apart from that, it is very small amount.
What do you tell people when you encounter them? What do you say? Because some people are very fixated on this. I've met them, and I make a choice as to who I'll engage with and won't, because ultimately a parent has a responsibility to make a choice for their child. We hope it's the best one. But what do you say to them?
I think the best example that we have right now is the HPV vaccine.
Yeah.
We use the data that is there available. Sorry. In the pyramid of knowledge, you have the base, which is, I think, my personal opinion, and that's the widest because it's the most common. And at the top, you have the randomized control trials, you have the systematic reviews. So those are the ones that have greater evidence. So we use that one up there. Yeah. We use that. On the other hand, we have there is a global advisory committee on vaccines, and especially looking at the safety of the vaccines from the World Health Organization. So we rely a lot on that, the resolution coming from that commission. So we provide information, and what we have found out is that when you provide information and give persons the opportunity to ask their questions, and you give them the evidence that is there, you provide them with the evidence, then it really helps to improve their decision making. So that is what we do. We follow we provide them with the evidence that we have for each one of the different type of vaccines.
Yeah. Is there any specific education that's done with perhaps the nurses or those who would administer the vaccination, how to overcome, especially when we know a lot of people take their babies to clinic, when they have to do that educational interaction?
Yes, with HPV vaccine, the nurses are already going to PTA meetings, meeting with parents, meeting with the students, just to resensitize them again about the need for the vaccine.
Yeah.
And in the clinics, as it relates to general vaccination, we usually do a session with the mothers before the clinic starts. Also, we have available flyers, pamphlets, leaflets for parents to take home. And we encourage, questions, any concern, check with your nurse.
Yeah. So it's good to know that we don't have that challenge as much as in other parts of the world. And in fact, when we look at countries in Europe where there was a big anti-vaxxers movement, they had, was it whooping cough? Whooping cough was in California.
Measles.
There was a measles outbreak in Europe. because of a result of people choosing not to vaccinate.
Yes.
Now, we also need to be very sensitized for measles in this part of the world still. Tell us why, even given the fact that we have such a good vaccination coverage.
Well, we recently had a case diagnosed in Guatemala. And Guatemala is right next door. Mexico had 4 cases reported. So because of the transmission rate, which is pretty high, it's 18, 19?
18.
For every positive persons, there can be 18 more infected when it comes to measles.
Wow.
And the spreading is pretty fast, especially among the non-vaccinated population. So we embark on responding to this threat and not waiting to have our first case of measles. Because now, as we said at the media breakfast, now it's just a matter of time. It's just a matter of when will we have a case of measles in Belize.
So you suspect that we will
The
face
number, well, we have a high amount of tourists coming in to country. And the success of not having measles is to have everyone vaccinated. So it's an opportunity now with the vaccination week in the Americas, and we will continue thereafter to improve the vaccination coverage among children below 10 years. So we're actively now searching for all those below 10 that may not have a second dose of vaccine. The reason for having 2 doses of vaccines is because children that receive 1 dose sometimes may develop the disease. So it was needed to have a second dose to improve the response from the immune system.
So you should have had 2.
So
in your
everyone should
lifetime.
have 2, yes, 2 doses.
Speaking of vaccination week, I'd like to segue a bit into what events we have scheduled for this week.
Let's carry on from what Dr. Beer mentioned with the measles, mumps, rubella vaccine. We are currently, again, thanks to the Ministry of Education, asking parents to submit immunization records to the schools so that we can check and see the amount of students that we need to give MMR vaccine to. We're looking at the under 10 population. Parents might be wondering, you know, I am unable to find my child's card. I'm not sure if the child had the vaccine. It is quite safe to give the child another shot if you can't show any documented evidence.
Yeah.
The
we
body
can't find
has its way of getting rid of what it doesn't need.
Yeah.
If we can't find the record, you can,
Yeah.
you know, rest assured that it is safe to give the vaccine.
And the problem with measles is that they run down the body when it comes to the immune system. So even after overcoming the disease, the acute phase, up to 3 years after, the person is still at risk to catch other diseases because of the measles itself. And there is a case in the UK of a girl that developed, she never received the vaccine. She got measles at 5 years, and 11, almost 12 years after, developed the complications of measles,
Wow.
which is a subacute sclerosing panencephalitis.
Okay, can
which
you give
is
us
just-
in English what that means? Yeah.
Exactly. You see how I struggle to just mention it?
Subacute.
So it's a problem with the central nervous system
Okay.
that it's been progressively deteriorated
Oh wow. As a complication
because
of the
of
measles.
not receiving the vaccine
Yeah.
early. So I mean, everything that goes into the body, food or whatever, have a consequence.
Yeah.
May have side effects. So vaccines is not exempt from that.
Yeah.
But the benefits are much greater than waiting on having the disease.
Just let me continue to add also about the activities for
Okay.
Vaccination Week in the Americas. The nurses will be out to work sites, construction sites, the rural areas. They will be going to the farmers. We have the population that is first-line workers. So we are ensuring that these persons are fully vaccinated against MMR, the measles, mumps, rubella vaccine. In Toledo on Friday, sorry, the preschools will be parading. We're going to have a presentation at first, followed by a parade that is in Punta Gorda. So we have a lot of activities going on around and about the country.
All right. Well, we thank you for coming in and having this conversation with us.
Thank you
Thank
very
you
much.
too.
We're going to go ahead and take a break, and when we come back, we'll be joined by representatives of the Apex Event Services. Of course, they're the managers of the Belize Civic Center, so stay tuned.